to the way we manage patients. My name is Dr. Raul Vasquez. I wanted to show you an area that's close to my office. My office is located right here, and if you look at the action that's going on around this area in terms of the number of diabetics being admitted, you see that even with the zip codes, we're talking about 129,000, and 178% of these individuals with diabetes. And when Hispanics only make a small percentage, only 8%, that's pretty significant. African Americans, 257, they're making up 41%. Again, a big condition that we often have to deal with, and there's a lot of costs attached to this. Uncontrolled. So these are people with diabetes and not being controlled. If you look at that, percentages are still dramatically high among African Americans for uncontrolled. Hispanics come out a little bit lower than expected, but I'm going to tell you that it may be because they're not coming to the office as much as they should, and as a result of that, that's where you're running into issues. With regards to the amputation rates in diabetic patients, we're finding that there is a higher percentage of Hispanics, 159%, and they, based on the percentages that they're making up of 8%, and African Americans, 254%. These are the zip codes that we're looking at, again, concentrated right here. And that separates from everywhere else. If you notice the way the hospitals are actually positioned, this is where the hotbed of these diseases are. When we look at quality assurance reporting requirement, and I'm looking more West New York, but if you look at the other areas, really not much of a difference. And these are the report cards for the managed care entities. When we say monitoring diabetes, we're seeing that of all tests, now these are just testing, remember, it's not control, these insurance companies are not doing very well. I mean, all of them are doing anywhere being less than 50% across the board because of the Medicaid managed care. I find these patients often get treated as second-class citizens as a result of that. When you look at managing in Western New York, the managed care entities, again, we're doing a lot of testing, a lot of things are being done, but when you're looking at the controls for the lipids, blood pressure across the board, we're in the 30s. If I was in practice doing this, I would not be in practice for too long in terms of the patient volume. This is from 2011, and that really goes back to 2010. So they're always a year behind. When we look at 2012, again, the same entities, the same insurance companies, and it doesn't matter if you're in Western New York, okay? You're still in the 30s in terms of controls, and I think that's not a good thing. I think because of the diseases that we're dealing with, it's something that needs to change. We look at preventive services. Now, this is where at least it should be a little bit easier for the Medicaid managed care entities. And if you're looking at BMIs, dental visits, and flus, we're talking really low percentages. And some of this tells you the trends are coming down with these insurance companies compared to other ones across the state. You're looking at, this is in 2012, the last one was 2011, and you're looking again, same kind of numbers, even for colorectal entities. These patients are not getting the care in light of the costs that the state is paying for. So, what are we going to do differently? I think what we're trying to accomplish is to kind of go through a different framework in terms of an action plan and implementation and monitor and setting objectives that I don't think we've done in the past. But we have to identify the risk. And we haven't done a very good job at that. And then successful criteria, accessing the risk, and producing action plans that are going to be quite important. With regards to Gbuahn in itself, I think the key thing in this process is it's a new entity in terms of a health home. And I think what they're trying to do with this health home is really develop a way for Medicaid patients to have physical medicine, mental health, and addiction tied in together. And what we're trying to do with the health home is exactly that. In addition to that, try to meet the health expectations of patients. And the patients should be at the center, even though we're talking about a health home model. With regard to this, we'll assign people to case managers, which can be registered nurse or licensed nurse practitioners. And at this point, what they'll do is basically help to monitor and arrange services for these patients, coordinate the medical, behavioral, and addiction services, in addition to work with the doctor that they have to implement the plan of action. That'll be important. Arrange appointments via transportations and getting these patients to actually get the services, which as physicians we're sometimes creating checklists, but the patients aren't following through on it. So this is just a little summary of what we're trying to accomplish with Gbuahn, which is the Greater Buffalo United Accountable Healthcare Network, and I'm Dr. Raul Vasquez, the CEO. Thank you.